Hello, I'm Rosalie Michaels, and welcome to the Pain Channel. There is a common expression about making a bad situation worse. We say you add insult to injury. Now, perhaps nobody can relate to this idiom more than people inflicted with the syndrome we will be discussing on today's show. Complex Regional Pain Syndrome, or CRPS, is a chronic pain condition that generally occurs after an injury or illness. It primarily affects arms and legs and brings upon an intense pain that is inconsistent with the severity of the original injury. Now, let's go to Dr. Sywick with more on this debilitating disease.
Well, thanks, Rosalie, and welcome back to all of you to another exciting episode on the Pain Channel. We're glad to have you back. Today's episode is a little bit about a horrible pain syndrome, but it is the exciting story of a patient's journey through that horrible episode, and now she's been able to positively affect the lives of thousands of others that have suffered with this condition. The condition is known as Complex Regional Pain Syndrome, or Reflex Sympathetic Dystrophy. The pain syndrome is a debilitating disease. To be honest, we don't know 100% all of its mechanisms. There clearly is a nerve component issue, and there's clearly some biochemical issues, but in the end, the patient is left with a debilitating disease that affects muscles and joints and nerves. It can, in some cases, and in the case of our guest here today, it can affect the whole body. The pain syndrome often presents with significant and horrible burning pain to the parts of the body that are affected. These areas of the skin, sometimes you can't even touch them, it's so painful. Sometimes when the wind blows or when clothing touches that area of the skin, it causes significant pain. Essentially, the problem in simple terms is simple everyday issues that wouldn't cause you or I pain are debilitating for a patient with reflex sympathetic dystrophy. So I'm proud to introduce you today to our guest, Barbie Engel. Barbie is a patient that has taken the journey of this painful condition known as reflex sympathetic dystrophy, and to Barbie's credit, she has changed the lives of so many other people through this disease. So let me introduce you to Barbie Engel. She's our guest today on the Pain Channel, and Barbie's here to tell us a little bit about her journey with reflex sympathetic dystrophy and what she has done in a positive way to affect so many lives of people that suffer with this debilitating disease. So thanks for joining us today, Barbie. I'm so glad that you could be here with us today.
Thank you for inviting me. I'm glad to be here.
Thank you for being with us. So tell me, Barbie, you know, a lot of our patients that are watching don't know much about reflex sympathetic dystrophy, but there are many out there that have this debilitating disease. Tell us specifically about your journey. When were you diagnosed and what happened?
Well, in 2002, I was rear-ended in a minor accident. The guy was going about 10 miles an hour, and I instantly had pain, and went to doctors and chiropractors, and they said that it was whiplash. And I started physical therapy and was getting worse, was complaining about this pain, but I didn't know the word to use was burning. And so doctors weren't really picking up what I was trying to say. So they sent me to a doctor here. I was actually at Washington State University. I was the head cheer and dance coach there, and the pain got so overwhelming that I couldn't coach anymore.
So a really active lifestyle before this accident.
Yeah, I was an athlete. I was well conditioned. I had a personal trainer that worked with me and my team. So when I couldn't get over the pain of this accident, I didn't know what else to do. So I just started searching and looking for doctors and trying to figure out what I could do to get out of pain.
Well, you know what's interesting is that patients that have reflex sympathetic dystrophy, some of them, it's after a significant trauma, a fracture of a bone, a surgery, but many cases are even minor injuries, a minor sprain. So in your case, it was a whiplash injury from an accident.
Right.
So tell me now, a lot of patients that will often come to see me, what's a frustrating component is whether they've had maybe a more moderate injury or even a minor injury, there's not a lot of physicians that recognize this pain syndrome early enough. So how was that for you?
Well, I am an extreme case, but I saw over 40 doctors before I was diagnosed.
Oh, my word.
And I started having surgeries. I had a shoulder surgery, and one of the symptoms is swelling. And so I had a lot of thoracic outlet swelling in my thoracic outlet area. So they decided they needed to take out a rib. So they took out my rib, and there were some complications. And then I had 5 pneumothorax. One was a full lung collapse. And there was actually a bone going into my lung and a second bone hooked around my nerve bundle. So it was causing further damage. And as this was progressing, the symptoms were spreading all the way down my arm. So after my lung surgery, I had to go back in a few months later and have the rib repaired again.
Wow.
So each time it worsened.
You know, Barbie's case, as significant as it is, has a lot of similarity to many patients that I will see, because the problem is if there's not early diagnosis, and this is often because, as Barbie said, you know, sometimes the physicians out there are not tuned in enough to even understand what reflex sympathetic dystrophy is. By the time I see many of my patients, you know, they'll come in, let's pretend in Barbie's case with a shoulder or an upper extremity that is painful to touch. It's often cold, it's often swollen, and by that time this disease has begun to progress to a level where, you know, treatment is very, very difficult. So tell me about your level of treatment then. Now you're to a point where it's starting to affect the upper extremities, and how's treatment going, or what are people telling you at this point?
A lot of the doctors were thinking that it was in my head and had me start counseling, and really I didn't understand that, because why would I give up everything that I had? I had a great life, and I just couldn't overcome this, you know, one time, this physical trauma. And finally I got to a doctor. I had seen cardiologists, lung doctors, neurologists, pain doctors, and all these different doctors didn't recognize it. I finally got to a doctor who looked at the whole big picture, and because there's so many symptoms that don't seem to match what's going on,
right,
like the discoloration, the cold extremity, swelling, sweating, all these things, they don't seem to match. And so finally I got to a doctor that had studied it and picked up that this could be it, and asked if he could do some tests. At that point I was very afraid to do any more testing after all the surgeries and whatnot. So it took me about a week to decide, and I went in and had a stellate ganglion nerve block.
Okay.
And that's how they diagnosed me.
Wow. So for those of you watching, a stellate ganglion nerve block is an injection that will do into the neck, and the idea is to put some pain medicine, numbing medicine, in around some of the pain fibers that are responsible for pain, temperature, sensation into the upper extremities. If a patient has a response to this procedure, mostly diagnostic, sometimes even a little therapeutic, it helps us to kind of confirm that, boy, there is a sympathetic component here, or as the name would suggest, a component of reflex sympathetic dystrophy.
Right.
So the good news at the end of this story is after 40 or so physicians, you finally dial into somebody that really understands reflex sympathetic dystrophy and understands the treatments. And then, in my mind, the fun journey began a little bit. Certainly, this has been a difficult pain syndrome for you, but at some point along the road here now, you're getting a little bit better, and all of a sudden it's a Power of Pain Foundation that you start. So tell me about that, because I tell you what, it takes a special person, let alone a special patient, to take something, a challenge such as this, a debilitating pain syndrome, and not only change your life, but through the Power of Pain Foundation, you have changed the lives of hundreds of patients with RSD. So tell me how that all started.
Well, after going starting treatments in 2005, between then and 2007, I was doing radiofrequency ablations and going through a cycle of those, and I was doing better. I could function more. And in 2007, I decided that what happened to me shouldn't happen to anybody. No one should have to see 40 doctors to be diagnosed. And so I got together with my family and some other patients that I knew, and we started talking about what can we do to help. And we decided that we would put a foundation together and get the word out, spread awareness, and help other patients. And so we started.
Amazing. So now I have read or seen something about this comedian that you brought into town. I know out at the ballpark where the Diamondbacks played, they had an entire night dedicated to your foundation. You were really on the move with this.
Well, we're working hard. The Diamondbacks actually came to us and asked us to team up with them to spread awareness for chronic pain and September's Pain Awareness Month. So we decided to choose a date in September and get that all going. And then we also have comic pain relief, which we try to use comedy and laughter to get pain off of the patient's mind just for a couple of hours.
Excellent. So for those of us that want to get a hold of your website and want to see what the Power of Pain Foundation is all about, what is the website?
The website is www.powerofpain.org, and I also have a blog on there about myself and about going into remission, starting with a process in 2009. And I'm currently in remission.
Well, that's absolutely wonderful, and what a great story, and clearly an inspiration for so many hundreds and thousands of patients in pain and patients with reflex sympathetic dystrophy. I can tell you that at the Pain Center of Arizona, we have been honored and privileged to have Barbie as a patient. There are some therapies that we have done for her to kind of make sure that we cover her in remission, and there are therapies out there. If you are a patient suffering with this horrible chronic disease of reflex sympathetic dystrophy, we'd love to see you at the Pain Center of Arizona and tell you some of the options that we have, whether it's a medication management approach and physical therapy modalities and injections. There's a lot out there to help you and to help get you back into life. Well, thank you, Barbie. What an amazing story, and thank you very much for being such an inspiration to the practice as a whole at the Pain Center of Arizona.
Thank you for what you do for me, and thank you for allowing me to be here today.
Absolutely.
Experience the Pain Center of Arizona and get back into life. Call 1-888-PAIN-CENTER.
Another new segment we're excited to debut this week is called Ask Dr. Sywick. The premise is simple. We give you direct access to one of the leading doctors in the field of pain by giving you, the viewer, a chance to ask him questions. Think of it as a trip to the doctor's office without the bill. Sounds pretty great, right? Well, all you have to do to participate is visit the Pain Channel website at painchannel.tv and send Dr. Sywick a question via email. Ask him anything you want. We promise not to bill you. Our first question comes from Mary Foster of Queen Creek, Arizona. Mary writes, Dr. Sywick, as a sufferer of RSD, I've had a terrible time managing my condition. What would you recommend as the most effective treatments for dealing with my chronic pain?
Well, thanks for your question, Mary. And certainly on today's episode with Barbie Engel and the issue of reflex sympathetic dystrophy, your question is hugely pertinent. So let me tell you, I usually will tell my patients that issues of treatment for reflex sympathetic dystrophy will often fall into three categories. Medications, number one, physical therapy, number two, and then possibly injections or more interventional treatments. And I could promise you from Barbie's story that at some level she's been through the ringer of all three of them. I certainly don't know where you are right now, Mary, with regard to the treatments that you have received, but I could tell you I'd love to sit down with you at the Pain Center of Arizona and go through your history with you. There are very good medications out there. We often refer to them as neuropathic medications that really help for a nerve pain component. Physical therapy is a huge issue and a huge benefit to patients with reflex sympathetic dystrophy. It gets those affected and difficult to move joints at least at some level moving, because often there's an issue of atrophy where those muscles have shrunk down and it's difficult to move those limbs. So physical therapy is a huge part of the treatment for reflex sympathetic dystrophy. And finally, there are interventional therapies, interventional injections. We mentioned in discussion with Barbie a stellate ganglion block. It's a nerve block that targets specifically the fibers, the nerve fibers that provide pain, temperature, and sensation to the face and upper extremities. There's a similar one in the low back area called the lumbar sympathetic plexus for patients with pain that's affecting the extremities, lower extremities, both of your legs. So there's some wonderful therapies out there. In fact, Barbie herself has undergone treatments with a medication called ketamine, which is doing some wonderful, wonderful work with regard to patients that have failed other reasonable therapies with regard to reflex sympathetic dystrophy. And finally, spinal cord stimulation can be very, very helpful in patients with this debilitating pain syndrome. So hopefully that answers your question, Mary. And for those of you at home, please make sure that you write in the questions to ask Dr. Sywick. I'd be more than happy to go over those with you on an upcoming episode on the Pain Channel. Thanks again.
Another positive step towards pain management is education and awareness. And here at the Pain Channel, we find literature to be an important aspect of the pain management culture. That's why we'll be continually developing the Pain Center Library with book reviews on relevant topics. Now here's Dr. Sywick with our first induction.
Today's author of our book review is our very own Barbie Engel that's done the interview with us. Her book is RSD in Me. It's How Do You Know What's Next? Tips and tricks for coping with chronic pain, and this is Barbie's book right here, RSD in Me. So Barbie, tell us a little bit about the book and who's this book for?
Well, I wrote the book based on my story, but I wanted it to be something more than just my story. I wanted to share with other patients, caregivers, the fact that you can do things to lower your pain levels. Even though you're not going to take your pain away, you can make your activities of daily living better. And I share those tips and tricks in there, how to go on an airplane ride, sexual activity, spirituality is a big part of my life. A lot of different things that you can do around the house with night lights and bed cradles so the sheets aren't on you because the sheets hurt when they touch you. Things like that, and how to do them inexpensively.
So I also see right here under the title RSD in Me, it says Patient and Caretaker Guide to Reflex Sympathetic Dystrophy and even other chronic pain disorders. But the issue here is that this is not just for the patient. This is for the caretaker and as you said, tips to kind of help even in the care of the RSD patient. Absolutely.
A lot of times when I'm experiencing pain, I won't be able to concentrate or think clearly. And so if your husband or your best friend or the person coming in to help you or take care of you can read the book and learn some of the tips, they can help you a little bit easier so that you save your energy and they also save their energy because they're not trying to figure out what to do. They'll have somewhere to start.
Certainly all great tips. And in fact, another one that I want you to share with us is how to complete a journal. You know, in my world of interventional pain and pain management, this is a huge part to bring to the physician so that he or she has an idea of what's a typical day for you, when it's at best, when it's at worst, what makes it better, what doesn't. So help me out with that. How did you figure out the whole journal idea too?
I started keeping track from the beginning because I wasn't getting better. They said that within 3 or 4 days I'd feel fine, and after 3 or 4 days I wasn't feeling fine, and I wanted to figure out what was going on. So I started writing down my pain levels in the morning, afternoon, and night, what activities I did so that I could compare, okay, if I do this, my pain doesn't seem to be as bad, but when I do this, it skyrockets, so that I could see for myself, not only for my doctor's benefit, but for my own benefit, what helps me, what makes me better, what makes me worse, and put that into a little journal that I had, and it really helped me get better care.
Fabulous. It's called RSD in Me, and it's by Barbie Engel, and we are so grateful to have Barbie on the show with us today and for our very first book review. Thanks again, Barbie, and thank you for sharing this. Please make sure you go on to Barbie's foundation site today and order a copy of RSD in Me. Thanks again, Barbie, and thank you so much for joining us today. It was a pleasure to have you on the Pain Channel.
Thank you so much.
Well, thanks for joining us on the Pain Channel for this exciting interview with Barbie Engel and getting a look into her dramatic story and certainly her story of hope and inspiration, a story of the Power of Pain Foundation and her book, RSD in Me. Thanks again for joining us, and now back to you, Rosalie.
Well, that's all the time we have for today. Be sure to join us next week when we talk about prevention and treatment of migraines. If you have a question for Dr. Sywick, don't forget to email him at painchannel.tv. We'd like to thank everyone who contributed to this week's show. I'm Rosalie Michaels, and I'll see you next Wednesday at 3 p.m. on the Pain Channel.